and welcome to Our Special Lives. I'm Laura McGrath, and today we are covering the topic, Can Functional Medicine Help Your Special Needs Child? We're joined with Dr. Aaron Hartman, who's been a guest on the channel before, and he's going to walk us through different ways that functional medicine may be able to help with issues that you're having with your special needs child. And before we get started, don't forget to hit like, subscribe, and share. Hi, Dr. Hartman. Welcome to Our Special Lives.
Laura, it's great to be here. Thanks for inviting me back again.
Of course. So today we're talking about, can functional medicine help your special needs child? So I'm really excited about this topic. I think it's something that every parent of special needs child should explore at some point. So first, let's start with the basic question. How is a functional medicine practitioner or doctor different than someone's, let's say, primary care physician?
In functional medicine, you tend to look for the root cause. And so it's not as simple as, someone has anxiety, depression, someone has a learning issue. Let's diagnose it and now treat it. You actually want to find out how'd you get there. And the thing about a lot of diseases or entities are actually more like syndromes. They're a combination of symptoms that the way you get there is different for different people. So a functional medicine physician would try to look back at the past, look at birth history, look at vaccine history, look at illness history, where you lived, trauma, nutrient status, look at all these things to try to figure out the story, that individual's personalized story to what got them to whatever's going on with them. And then based on that story, you address things. So in conventional medicine, we need a diagnosis, we need a code, and based on the code, there's certain approved therapeutics. The functional medicine world looks more at systems. How does everything interact with everything else? And then once you understand that interaction, how can we now address these underlying issues? One of the tenets of functional medicine is, if you give your body what's lacking and remove what it doesn't need, it tends to want to heal itself. And so that's kind of the underlying idea, is what is lacking in your body, what is in excess that you need to get rid of, and then will your body then at that point in time begin to heal or improve its function. And that's individual. You can have 5 people with depression, 5 people with autism, 5 people with ADHD, and their stories are all different. Shouldn't their treatment be different? And the functional medicine approach is yes, all the treatments will be different.
Yeah, that's great. One of the things that I'm going to do is link to the Institute for Functional Medicine. They've got Find a Practitioner. So if someone's listening to this video and they find it to be helpful and want to learn more, they can go to the link below and they can look for a practitioner in their area. So what we're talking about today is how functional medicine can help children with special needs. And so let's talk about the big ways or the big systems, as you mentioned, that kind of impact children with special needs.
There are many different ways to look at functional medicine. This type of practice goes back decades, actually. The Institute for Functional Medicine has their paradigm. A4M, which is another organization, has their paradigm. Different systems approach. The major system for most kids with special needs is the gut immune brain axis. You can talk about the hormones, adrenal, thyroid, pancreas. You can talk about detoxification, which are the organs of detoxification. And that's where toxicity comes into play. You can talk about developmental sex hormones. But for a kid that's neurologically developing, the major system is the gut immune brain. So that's how your GI tract, which produces 90% of your body's serotonin and half of your body's dopamine, which accounts for 25% of the conversion of thyroid hormone T4 to T3. There are as many neurotransmitters, there are as many nerves in your GI tract as your spinal cord. So your GI tract is a huge player in brain health, whether it's neurodevelopmental or disorders in young kids, or whether it's Alzheimer's and Parkinson's in the older. We now know that Parkinson's and Alzheimer's start between 20 and 30 years before the diagnosis of those two diseases, okay? And it's the gut, the immune. Well, once you realize 90% of the immune system is around the GI tract, affecting that is helpful as well. And these all play in the brain function. And the brain is its own organ that creates its own neurotransmitters, that creates its own modulators and creates its own inflammation. And so it's an interplay of these 3 systems. And that's one of the ways in which in the functional medicine world we look at things. I'm mentioning that because that's the major player in most, if I was to make a general statement, in most kids with some kind of neurological situation.
Okay, got it. So let's break this down a little bit. Let's first talk about the gut. So I am a parent of a child with cerebral palsy. There's probably many parents who have children who are on the autism spectrum listening to this. So let's talk about, what are the issues with guts in these
Okay.
children? And then the second part would be, what can we do about it from a functional medicine perspective?
Yeah, well, I also have 2 children with cerebral palsy, so I totally get the feeding issues, the developmental issues. Those are so huge, and that's actually what got me into functional medicine was my family. And the way the gut is important is the gut actually primes the brain for neurodevelopment. So what we're learning in some higher science is that the bacteria in the gut, the lining of the gut, the interaction inflammation gut actually train the brain how it develops neurologically. So one of the biggest factors that is the mixture of healthy bacteria, Bacteroides, Firmicutes, these other kind of bacteria in your gut that actually make neurotransmitters. And then one of the biggest things that affects that is the actual food the children eat. There's these things called pseudo neurotransmitters that are products made by bacteria that act like neurotransmitters. That's one of the ways you explain, hangry. When kids get kind of hangry and upset, that's actually a withdrawal phenomena from some of these pseudo neurotransmitters being pulled away, and they get almost like a withdrawal thing. So it's interesting how much diet, what a kid eat, actually can prime them up for neurodevelopment as well as neurobehavioral issues. So diet is probably the biggest key thing that occurs at birth and in the first 1 month, 3 months, 1 year, 2 year. I think that the good news is, even if you're starting this journey a little later, we adopted our first daughter when she was like 1.5 years, our second daughter when she was 2 years old. You can still change the course of neurodevelopment, of brain development. It's just optimal to start it as early as possible.
Yeah, and I know we could dig into this topic for hours, but in general, what are some things to avoid for good gut health, and what are some things to add for good gut health?
So things to avoid are processed foods. That's the general blanket. So the biggest offenders in processed foods are going to be processed gluten, dairy, and processed oils.
What about formulas?
Well, they're going to have processed dairy, processed corn. It's amazing how much high fructose corn syrup, corn solids are in formulas. And those things, those sugars feed yeast and feed certain types of bacteria that create these pseudo neurotransmitters that I was talking about. You want to expose a kid to real food that's complex, as healthy fats. The other thing that's really bad with a lot of processed foods is the fats in the foods are processed. And these fats actually cause inflammation all of their own. You can actually increase risk for cardiovascular disease, brain disease, cancers based on your consumption of oils. And so when the baby's brain is sensitive, when it's developing, when it needs a lot of healthy, high quality nutrition, you got to focus on that. And that's where the diet becomes hugely removing those processed foods. And then what you want to put in is you want to put in these nutrient dense foods that aren't caloric dense, but are nutrient dense to give the body what it needs to repair and decrease inflammation.
Okay. And so what about things like probiotics? What about things like adding in some fish oil, or other, DHA, things like that? Like if you had maybe a top 3 list of the things maybe you give your own kids, what would that be to really boost the health of the gut?
And what are you talking about, a particular age group or just in general for kids?
Maybe, let's call it 12 and under.
Okay. I mean, probiotics are hugely important. They actually seed the garden of your gut as far as what's going to grow. So you want, and the ideal way to get that is fermented foods. Either it's cabbage, sauerkraut, kombucha, kimchi kind of foods. A lot of people they're not from cultures that use those. That's where probiotics can be helpful, but also fibers. The healthy bacteria have to eat healthy fiber, and they make this thing called butyrate, which is a short chain fatty acid that's actually one of the major sources of energy for your brain, your blood-brain barrier, and your gut barrier. Well, that's actually made by healthy bacteria in your gut eating healthy fiber and making these things. So it's really kind of interesting how your gut is its own factory house for healthy chemicals that your body needs. And so having the right kind of fiber, probiotics, and then just the other thing is just the food chemicals. They're called phytochemicals. They're what gives foods color. The anthocyanins are the purples, right? Your flavonoids are your yellow oranges. Like getting lots of those color in the diet also help with gut inflammation as well as feeding these healthy bacteria.
Got it. I actually use something called acacia root fiber,
Mm-hmm.
which is a prebiotic fiber. And I also put it in my son's food, like if I'm doing like smoothies or whatever. And that's a like a really good fiber to feed those gut bacteria without necessarily, he doesn't necessarily eat like I'm talking about my
Yeah.
typical child, doesn't
Yeah.
necessarily
Yeah.
eat like a ton of vegetables and fruits like I'd love him to do. So I kind of sneak in some fiber that way. So if you're feeding a child a blenderized diet, or if your child will tolerate a smoothie, I find the Acacia gum fiber, you could just buy it on Amazon, I'll link to it below, is a really good fiber for the gut bacteria. Are you familiar with that, or do you use any sort of fibers like that?
Yeah, I use a lot of acacia root powder. It's actually great to grow bifidobacter, which is one of the particular kind of bacteria in your gut. It's dissolves really easy and it's
Yes.
not really palatable, so it's really kind of nice. And there's actually a particular brand, Heather's Tummy Fiber, which is like an Acacia Senegal, which is there's different kinds of acacia root powder. It's actually a more specific one that has it's a little more tolerable. But actually, that one by itself, I've used it for some of my patients with IBS and SIBO issues, to use that to treat those. So that's a great dissolvable fiber. Inulin's another great one, which is like, if you've heard of chicory root,
Yeah.
they're full of that. And that dissolves really well also. And
Well, good. Okay. So basically, just to recap, we're going to good oils, we're going to whole foods, and we're removing processed foods,
yeah.
possibly adding in a probiotic. If the fermented foods are not something that are available or easy for you to feed your child, is there a particular probiotic that you like?
I it, it depends on what's going on with the kid. If you want a good generic probiotic that's pretty easy to use, there's a Therabiotic by Clear Labs. They have a chewable pill version for younger kids. They have a powder version to put in smoothies, and they have a capsule version. So it's kind of they have a really good diverse product line. But if you want just a generic recommendation, I use their Therabiotic Complete because has a little chewable pill for kids. It's got a powder for higher dosing, and then the regular capsule. If you have lots of SIBO and lots of gas issues, and some kids are bloated, a lot of the kids with autism are bloated all the time. They get stuff and just their gut reacts. Sometimes, using sporulating probiotics, which actually don't do a whole lot in the small bowel. They do more in the large bowel. They can be more helpful in those kids as well.
Is there a brand for that you recommend?
It depends on what month you ask me what brand I'm going to recommend, as you know, right?
Yeah.
Right now I'm using OrthoSpore IgG. It's a sporulating probiotic with IgG in it. And IgG is something that's in breast milk. It's a part of your immune system. It actually helps calm some of that inflammation down. So some of my patients who can't tolerate these kind of things, they react. Actually, giving that immune modulator with the probiotic is really nice.
I think I need to take that.
Yeah.
Okay. All right. So that is the gut. Now let's move on to the brain. So we talked about gut inflammation, brain inflammation. So let's talk about, what type of brain inflammation are you talking about, and what can we do about it?
So the with brain inflammation, a lot of it is in the there's different kinds of cells. And there's the neurons people think about, but a lot of this inflammation is actually occurring in the accessory brain cells. They're called microglia and astrocytes. So you kind of got these helper cells and these inflammatory cells, and that's actually where most of the action in the brain occurs with inflammation. The microglia actually are monocytes that are in your blood that migrate to your brain, find a place to stay, and just hang out there because of where they originated, which was your bone marrow, then to your blood, and then to your brain. They actually have these chemical or cytokine connections with the rest of your body. So when you get a trauma or injury, you get a concussion, when they get activated, you can actually have brain-induced leaky gut. So if you ever had people like get a concussion, they get diarrhea, that's part of that connection with this immune cell. And so calming these microglia down can be really super important. When you get traumatic brain injuries, for example, and you get this big inflammatory response, one of the things that's really helpful for calming that down is EPA. You mentioned fish oil before. High doses of EPA and DHA are very helpful in calming down neural inflammation. The gut's a huge part of that. There are different nutrients like curcumin that I've used successfully in kids with special needs to help calm the brain down. And there's even, with some of your autistic kids and even Pandas Pans kids using things like LDN or low-dose naltrexone as an immune modulator. That requires a physician, prescription. But there are tons of anti-inflammatory compounds like omega-3s, like curcumin, that can actually help vitamin C, and even getting the right amounts of minerals can actually help with brain inflammation, like magnesium. About 40% of Americans are magnesium deficient. for example. And a lot of these kids with these processed diets, one of the things that's processed out are minerals. So a lot of these kids are already, at the cellular level, deficient in magnesium, deficient in a lot of these essential minerals that you need for appropriate brain function.
Potassium's another one that was kind of shocking to me. The RDA is like 4,700 milligrams, and a banana has like what, 30 or I don't know.
People go to bananas all the time, and it's like that's not a whole lot. Even when you supplement, people always ask me what potassium supplement to use, and potassium can be a little irritating to your stomach, but you get a capsule of 100 milligrams, right?
Yeah.
Of potassium, and like, to your point, it's like you need 4,000, 3,000. If I have someone who's really sick, who has a lot of heavy metal issues, I'm pushing them maybe 5,000 or 6,000 milligrams of potassium a day. Which, if you have a functioning kidney, you pee out the excess. But that's one that, yes, you can supplement it, but the best way to get that is by eating potassium-rich foods. It's hard. Yeah, the supplementation, like taking a little pill for potassium and thinking you've got there, is it's woefully inadequate.
Yeah, it is. Okay, so minerals. We're talking about curcurmin, like turmeric.
Turmeric, correct.
Yeah, and EPA DHA, which we also talked about was good for the gut. We did a whole video on lipids, so I don't want to repeat that, but I'm going to link to that, and people can go there if they're interested in some of those supplements that we use for good lipid, because it sounds like those are both for the gut and the brain.
Yeah.
Anything else for the brain that you recommend?
Well, there's probably, and this is where you get into some of the nuances on what's going on. There's a whole thing with mast cell activation syndrome, and there's things like quercetin, which is one of those bioflavonoids you can find in onions and apples. It helps a lot with leaky gut issues, with immune stuff, but also is a huge player with brain inflammation. So that's something that I use with my gut immune brain patients and kids, because the quercetin is like it's like it basically works on both sides. It does a lot of different things. And that's also where curcumin is really nice, because curcumin helps produce more bile. It helps the liver detoxify. One thing people have to realize when you talk about a lot of these nutrients, I like to use curcumin because it's probably the most researched one in the world. I mean, people have been using it medicinally for thousands of years. There's over 83 different chemical pathways that it affects. So, and that's what we've learned. I mean, there's probably more that it does. So when we talk about these biological, nutrients, you have to realize, I might say it does inflammation or it does gut, but you have to realize these things are, it's called pleomorphic. They do lots of different things in lots of different parts of your body. So finding one that does multiple things to keep the regimen simplified is kind of one of the things we try to do. So that's, quercetin's a nice add-on that does a lot of different things.
Okay, and then how do you get that into a kid? Is there a chewable? Is there a capsule that you like? Do you put it in smoothies?
It all depends. It all depends on the kid. Like with my daughter, for example, we made smoothies initially, and they were the most nasty tasting things. Like I was like, "How is this girl?" And she was a trooper. She was swallowing these things, and when she realized she could swallow, she never went back. So, and that was me taking the capsules, opening them, putting them in something, and then she got the point she can swallow. Kids who have tube feeds, sometimes they're almost
orally sensitive, just textures and that kind of stuff. Yeah. How do you get the stuff in them?
Well, that's when you just try to work on the textures. What's their issue? Some of them, that's also might be an issue with dosing. You might not do as high of doses. Curcumin does have some liquid versions that kind of taste kind of funny, but quercetin's relatively benign, and taking a capsule and dumping it and stuff is pretty easy to do with that.
So quercetin for my son, my typical son, we gave that to him as like sort of an anti-COVID measure. We found a brand that was a chewable, and it's a chewable quercetin tablet called Snifflex. And it's got a little quercetin and some zinc. And because zinc is the key that allows quercetin is it unlocks the cell to allow the zinc into the cell for antiviral, right? Yeah. So I'll link to that chewable below, but that might be something that's like a little bit more palatable if kids have oral aversion.
Do you remember off the top of your head how many milligrams of quercetin was in that?
I don't, but
typical dosings, I mean, anywhere from 100 to 250 milligrams of quercetin.
Yeah.
And you can do that like 4 or 5 times a day, depending on what's in the product. So.
Yeah, we were just doing it a couple times a day. I want to say probably like 100. It was probably, on the lower end, but.
Gotcha. Yeah, I use quercetin and turmeric myself during allergy season here in Richmond, where supposedly we're like the allergy capital of the country. And I used to get bronchitis twice a year, every season. And I haven't had one in almost 10 years now. And I basically start quercetin, turmeric about a month before my allergy season. Start doing neti pot stuff as well, just to
Yeah.
kind of as a primitive, and they work really well for a lot of those kind of things.
Yeah, I mean, anecdotally, like as soon as COVID hit, we were all taking, including my special needs son, we were doing the quercetin zinc combo,
Yeah.
and my husband got COVID and none of us did. And, maybe
Hmm.
that was just total coincidence, but I think it's funny because we were all exposed. He was sort semi asymptomatic. So we were all like
Yeah.
totally exposed for 5 full days, like in each other's faces, and none of us got it except for him. So,
Yeah.
who knows? But anyway,
Yeah.
I think
Yeah.
it is helpful.
I've heard
Uh,
that story a lot, actually. So,
yeah. Okay. So we've talked about the brain, we've talked about the gut. Now let's talk about, this is a good segue for the immune system.
well, the immune system is interesting because it's what connects the two of those. And so realize that about 89% of the immune system is around your GI tract, but you also have these microglia, these immune cells in your brain, and then you have immune cells that migrate through your body, and then you've got nerves that connect, neurological immune cells to other parts of your body. So the immune system, it's everywhere, right? It's in your skin, it's in your head, it has to be everywhere to fight off infections, viruses, cancers, etc. But it's centered in your GI tract, which all of a sudden makes gut stuff one of the primary things for your immune system.
And can I just interrupt you really quickly? When we say immune system, we're not necessarily only talking about like not getting colds that come
Yeah.
around and that kind of thing. We're talking about almost like a systemic overreaction of the immune system that can actually cause a worsening of symptoms in children with special needs,
Correct.
right?
Yeah,
Yeah.
your immune system is always being trained mostly to ignore everything. So, you want 99.999% of the time, you want your immune system to ignore pollen, to ignore peanuts, to ignore that random virus, that random bacteria on your skin. You want it to ignore all that stuff. When the system gets dysregulated and ramped up and starts overreacting to peanuts, dust, allergens, stuff, that's when you can get an overreaction of your immune system, or when it gets kind of beat down so it just doesn't respond to anything. And that's kind of where you get escape with things like cancers and other, or low grade viral, or these low grade infections like chronic Lyme or chronic mono, or whatever, where your body can't kind of put them away. So that, and then the immune system is also a point for healing. People forget that inflammation, right? You get an injury, you bruise yourself, you cut yourself. There are immune cells that come there that eat up the dead tissue and then start the healing process as the inflammation calms down. So you actually need a healthy immune system for healing from injuries. So your immune system just does so much and touches on so many different parts of your body's function.
And so when you have a child, let's say with, autism or pandas or something like that, you can actually see that an overreaction of the immune system or sort of this persistent inflammatory response can actually make a worsening of those symptoms.
Correct. Yes.
Yeah.
Yeah. You can actually there's actually advanced testing where you can actually look at different parts of the immune system to see they're overreacting, to look at kids' guts. With some of my PANS patients, they've almost all had positive strep in their stool. And so it's like, if you've got strep in your poop, whatever you do has to keep those count that down long term. And that's where some of those kids will get on, preventive antibiotics for, months and months and months and months. Well, there's also other ways to suppress, strep growth in the GI tract and to prevent recolonization.
Okay, got it. So when we're talking about inflammation, or sorry, the immune system for this purpose, we're talking about wanting to maintain a very modulated immune system in the system of a special needs child so that they're optimally functioning and not having increased or worsening symptoms because of a dysregulated immune system. Is that
Correct. Yeah,
correct?
that's
Okay,
correct.
so what are some things that we can do to bolster the immune system in a child with special needs?
I mean, the primary there's internal and external. We'll start with the internal. That's diet. What do you put in your body? Clean water, clean food. People don't realize that, inhaling chloroform in your water, chloroform is a neurotoxin. And people don't realize that's what you're inhaling in your showers. They don't realize that chlorhalomethanes are these chemicals that are put in the water to clean it and scrub it and clean the piping at the water distribution site that's actually in your water when it comes to your house. There's an interesting website on the environmental working group. It's like a tap water check. You can go in and put your zip code in there and see what's in the central water distribution part anywhere in the country. It's an eye opener to see what's actually in the water, food, and so the stuff going in your body, and then there's also the part of stuff outside your body. there's a lot of research that's highly suggestive that pandas, PANS, CIRS, maybe even psychosis and other bipolar issues have a CIRS component, chronic inflammatory response syndrome component. And that is largely environmental things activating your immune system. 80% of that is mold or water damaged buildings, but that can also be other toxins, other chemicals. And so all of a sudden, the environment these kids are in, is there water damage in the house? Are there mold issues? Schools, it's amazing how unclean the air in schools are. I mean, it seems like every couple of years there's some outbreak of something, that whether it's Legionella or something else. I don't want to say too much because depending on where you're at, you've probably had one of these recently. And the external environment is huge because that's things that bombard the immune system from without that can activate it. So I start from within, then go to without. What's the environment look like? That's kind of the basic starting point.
So if you are having this sort of outsized immune reaction, or you are symptomatic, or you're noticing that symptoms are worsening in your special needs child, what are some things that you can do? I mean, obviously, trying to figure out whether it's an environmental issue, there's some testing that a functional medicine doctor can do to figure out if you have, chronic mold or some sort of other allergy that's going on, correct?
It's also the story. Like I had one of my patients who was doing great with his, he had like this diagnosis of Asperger PANS. It's kind of, they didn't really know where to put him. He was doing great. And then all of a sudden was reacting in the spring, and the neighbor across the street just sprayed the yards for bugs. And all of a sudden the mom realized, oh yeah, every spring he has this thing, and she kind of correlated the story. So it's a lot of it's the story. No one of my patients, he has issues in the spring when the humidity here in Richmond goes high and you have a lot more mold and bacteria in the air. So part of it's the story, what's when they flare, kind of dig. And that's where the parent has to know the kid. The parent has to have a good relationship with the practitioner that takes the time. And that's part of functional medicine, is taking the time to figure out some of these things. But you have to look at the environment, the food, and then they can just be reactivation of indolent or indolent infections, whether it's reactivation of mono, reactivation of Lyme. I had patients who, when I was doing testing on them, they actually had reactivation of their chicken pox. Their titers were crazy sky high. And so you have to kind of give them some viral immune support. So and that's where a lot where the gut stuff comes into play. So I wish I could give you a simple, like, this is what you should do, but that's where knowing your kid, paying attention, and it takes, recurrent flares to like figure things. Stressors, can also be, a lot of kids like
emotional stressors.
Exactly. Yeah. They're people realize that emotional stress can react physiologically on your brain, just like a traumatic brain injury.
Yeah, because you're producing cortisol and adrenaline and this whole chemical cocktail, which is actually a physiological.
Yeah, and it's almost and tip, and the parents for these kids especially, a lot of times they have their own trauma, their own stuff they're dealing with their kids with special needs, and sometimes the kids are playing off the parents, and mom or dad's having a bad time, there's relationship issues, and all of a sudden the kids feeling that stress, and the way it plays out is their behavior. So that's where knowing yourself, knowing whoever your partner is, knowing your kids, and having basically a sleuth, having that, person who can be with you to help you interpret this stuff. Because it takes, people can figure it out. It just takes a long time to do it on their own. That's where having someone to help them can be super, super important.
Okay. So we talked about kind of these acute and somewhat severe, either environmental or internal reactivations and triggers for an immune system sort of gone awry. Let's talk about just kind of like a baseline kid. You want to keep their immune system, healthy and, functioning well. Are there one or two things that you can kind of do on like a day in, day out basis just to make sure, other than, we've talked about whole foods diet, clean water, those sorts of basics. Is there anything and we also talked about quercetin, we talked about, curcurmin. Is there anything else that's kind of a go-to for you as far as keeping an immune system healthy?
Exercise.
Okay.
These kids, it's really interesting. When you're born, all of our brains break down after birth. They all break down. You have all these connections, tons of connections when you're born. And part of what your brain starts doing is, as you start using it, you use your left hand more than your right hand. All of a sudden, those pathways that make you left-handed start getting myelinated. Okay. You start reading English versus Spanish versus whatever. The part of that linguistic part of your brain that can pick up the auditory differences, that starts getting myelinated. It starts getting insulation laid down. You want to learn a new, you start a sport with a kid, to start soccer. All of a sudden now the balance and coordination, the mental planning, a lot of things with kids with special needs, it's like mental planning. How do you plan out? You have a soccer game, for example. Kids learn how to plan out 4, 5, 6, 7, 8, chess. You learn how to plan out 4, 5, 6, 7, 8 steps in advance. That now trains the brain to actually think in advance. Activating the brain, the best way to activate the brain in a developing kid is physical activity. And it's really, really interesting to me, like with autistic kids, for example, you put them in a sterile room with walls and a light and a computer. You do that for an hour and pull the computer away. The kids go bonkers. And then you put them outside, and all of a sudden it's like it has this massive calming effect because they're getting so much stimulation, the wind on their face, the grass on their feet, the sounds, the smells. Being outside is a very robust, rich, stimulating environment. And with typical developing kids, that's, you're going to need high-end level sports. They're already doing that, high-end private schools, they already have these kids doing this stuff. So, being outside, physical activity, that is one of the huge things that actually helps these kids, a typical kid's brain develop. And also is a huge part, with our daughter with cerebral palsy. It's been interesting how, when we first got her, she didn't, couldn't sit up on her own. She was never supposed to walk or talk or anything like that. And physical activity was always a huge, huge part of what we did with her. Initially, it was just having her sit and me holding her and just trying to keep her from falling over. It was years and years and years, but eventually her brain kind of relearned some of those pathways, and she's now able to walk with, forearm crutches. That's 10 years of, I always joke she'd be an Olympic champion if, she was neurotypical, right?
So many hours in on her PT.
Yeah, exactly. I know. It's like, you get the Malcolm Gladwell, 10,000 hours, you're an expert, yes, a professional. But that's where, for a typical kid, physical activity, activating your muscles make immune modulating chemicals called myokines, and they're actually activated by physical activity. We were talking before we started recording about growth hormone. That is actually activated by physical activity. And if you're physically active with certain foods or not certain foods in your stomach, you actually will make more growth hormone. And so your kids want to be outside, get them outside, get them off of video games and screens. There's actually a book, an interesting book called Last Child, I think Last Child in the Woods or something like that. And it talks about how the idea of kids developing in nature and outdoors, like how rich that is and how it develops their attention to detail, their attention to the environment, like how that's being lost. And that's might be one of the, and that ability to focus on things and ignore most of the environment. That's anti-ADHD, right? I can focus on this thing and ignore all else. Well, the opposite of that is attention deficit. Well, you can't focus. Your attention's always redirected. And so getting outside, being physically active has a huge impact on neurodevelopment on any kid.
Yeah, it's fascinating that you're saying this because so my son is chair fast. He can't walk, and he has cerebral palsy, but it's the kind of cerebral palsy where he never stops moving. It's not spastic CP; it's called chorioathetoid CP. And so what's very interesting is when we take him outside to take him for a walk, even if he's in his wheelchair, because he's always constantly moving and he's using his muscles and stuff. It's just not in a functional way. But he calms down so much when he's outside. And now that you're saying that, it makes sense because he's actually getting stimulation and his brain is kind of probably regulating that stimulation, whereas inside it's a bit of a deficit.
Well, there's actually a field of medicine in Japan called forestry medicine. And the idea is like being in the woods is medically therapeutic. And so they have these things. And this is one of these things only, you only do in Japan kind of sort of where you have these execs that are working their 16, 18-hour days, right? They take the bullet train out of Tokyo for, 45 minutes to the woods, to these trails, and they measure their heart rate variability, their cortisol levels. They actually do like this throughout this trail, measure cortisol salivary levels, and they watch it plummet. They watch the heart rate variability shoot up, just from being out walking. And then these guys, of course, get on the train, go back in town and work another, 8 hours for that day or whatever. But the idea is like, you can actually get a PhD level education in this one small thing. It's being outdoors is hugely therapeutic. It's and you start reading different stories, like in the military, for example, a lot of the bomb sniffers were actually people from the Southeast, hunters, people outside. They actually trained themselves to pay attention to sounds, things being out of place, abnormalities in the environment. They actually are really good at spotting IEDs, or these bombs that are buried. And they actually, just from being out in the woods, they learn this fine tunement to, that doesn't look quite right. And it's really interesting how nature exposure translates to other things, like developing your brain, learning a musical instrument, learning sports, learning to be outdoors and like to draw a bird. All these, everything translates. Everyone wants to specialize in something. And the thing about it is you want to develop as much of your brain as you can, because all these things translate, whether it's languages, which is one way to stimulate the brain, whether it's music, whether it's sport, whether it's just learning to draw. All these things actually translate, and they're all making interconnections in your brain. The more interconnections, the more plasticity, and the more your brain can vary in a new circumstance. And ultimately, I think we're trying to create resilient kids that are maximally able to adapt to an environment. They're going to need a lot of stimulation and a lot of reserve.
But make it good stimulation, not video games.
Yeah, pretty much.
Okay, good. Well, that is really helpful. So basically, bottom line, best thing you can do for your special needs child is get them outside and get them doing some exercise outside.
Yeah.
Okay, wonderful. Any other last parting thoughts for the audience on, special needs children and functional medicine?
I think, functional medicine is allows a unique approach where you can individualize the plan for a special needs kid. Your child with cerebral palsy is going to be different than my child, and my one daughter is different than my other daughter with cerebral palsy. And being able to individualize that is huge. That's true personalized healthcare, personalized medicine, and that's the model around which functional medicine operates. And so I like the idea that the care for this person is different than the care for this person, even though their titles or diagnoses may be the same. I feel like that's more appropriate, especially with all this technology. We have all this technology, all this cool testing we can do. We can check your environment for VOCs. We can check your stool for the byproducts of metabolic metabolism. And why can't we use that and then individualize a program for somebody,
Yeah. No, I think that's awesome. Well, thank you so much for joining us today. I really appreciate it. I think you've given our audience so much good information, and I'm going to link to everything we talked about below. So if anybody has, any questions or is looking for something, they can just check the show notes.
Right. Lots of links.
Yes. So thank you again for joining us.
Thanks a lot. Take care.
Okay.